Good morning, everyone. Hi, and welcome to today's video. I'm Mary Felling, physical therapist, and for the last 25 years, I have specialized in an area called myofascial release, the John Barnes approach. Today's video is going to be how to treat your psoas muscle, and I'll talk more about the importance of that as we get into the treatment technique. I do want to tell you I'm going to start with one position, which is about what 80% of you will be able to do. It's lying down on a ball. We're going to use compression. We're going to use different thicknesses of balls to work on the psoas. And then I'll have two modifications following that particular exercise technique that are for the rest of you, because some people are too painful in their back, and they might have spinal or cervical neck problems that create difficulties for them to lie on their stomach. So if this looks too hard for you, or you know you can't lie on your stomach, just hold tight. After this technique, I will move into those other two modifications, and one of those are bound to work for you. All right, so here we are. We're getting ready to work on the psoas. You can use any size ball you want. You can use a tennis ball, a racquetball ball. But I would tell you the first time out, I would use something really squishy, just because the psoas muscle is usually pretty tender on most people, or it's very tight. So if this is your first time, you can get a squishy ball, a dog's chew toy. You could use a washcloth that you've just rolled up or tied in a knot. And what you're going to do is you're going to be on a flat surface. It can be the floor. It can be a very firm couch, probably not a bed. A bed's probably too soft for this. You have two psoas, by the way. One on either side of your belly button that runs kind of like a capital A, so it's running this way from the belly button, about an inch to the side of the belly button and down. That's where your psoas runs in the front. It actually originates back on your lower lumbar vertebrae. So you're going to lie down on your side. You eventually will do both sides, so it doesn't matter which side you start on. And you're going to take your ball. I'm going to use the squishy one. I'm going to put this firmer one to the side for a minute. You're going to take your ball, find your belly button, and you're going to go about an inch to the side. That's where your ball goes. Lie all the way down. And use your top leg to kind of help you slowly move over onto the ball. And you'll find you have to change the position so it doesn't roll on. You don't roll onto your belly button. Your arm, so I'm working on my left side. My left arm is down behind me, and I've got my leg a little bent to give me support here. And my arm in the front is also here to give me support. And you're just going to move around until you find a tight or tender spot. You're on the psoas, and you're going to think, well, I'm on my stomach too. I must be on my intestines and some other things. Yes, you are. You definitely are. But because you're on the psoas and everything else is soft tissue, they'll probably benefit too. And you're feeling for a tight or tender area. And I'm already on a tender area. It makes me feel a little nauseated, actually. That's how tight that is. And in this position, so we've started our clock. If you're still trying to find a position or find a spot, pause the video right now where it's at, and then once you find a tender or tight spot, come on back. For those of you who have found the spot, if you're tender and you're on it, as long as you can be relaxed while you're on the ball and you're breathing naturally, you're okay. But if you're fighting it and you're pulling back away, then whatever you're using is just too rigid, and you need something a little softer. So grab a washcloth, a face cloth, a hand towel, tie it up in a knot, use that. Use a dog's chew toy. If you have something squishy in the house, maybe you have a couple of socks you can roll up and put in a bigger sock and use that. But you really want to start on a pretty firm surface so that it pushes that ball up into the psoas. And so what you're feeling for is a spot that doesn't feel good. You might be on a spot and think and feel that, well, I don't really feel anything there, but I feel discomfort up in my, just below my rib cage, or I feel nauseated or something. So you're on a good spot if you're feeling anything that's happening around the area. You're good. Now, some of you will get in this position and you may not feel a thing, and you think, I just feel tight, I just feel rigidity there. Great. Stay there for at least 30 seconds, because it takes 30 seconds sometimes when someone's really rigid in a spot before there can be enough compression for that area, for that knot to start softening. And then after 30 seconds, most people say, oh, I do feel that that is getting uncomfortable. So just because you're on a spot and you don't feel it, you don't feel any sensation or pain, doesn't mean it's not a good spot, especially if it's really hard and guarded. Stay there for a little while, and I think you'll start feeling that sensation that it's uncomfortable. So we're doing a myofascial release. So myo means muscle, fascia is that cobweb that runs through our system from top to bottom, side to side, and front to back. It's a three-dimensional cobweb. And that cobweb, the fascia, is often overlooked in traditional therapies and traditional medicine, although now it's getting a lot more light shown on it, which is great because now we're treating the fascia. But traditionally, the fascial system is overlooked, it's not treated, and that's why a lot of problems in soft tissue like strains and sprains and overuse and inflammation problems don't always go away. They become a chronic problem. Well, it's because we're addressing in the medical field, they've been addressing the muscle, but not the fascia. So today, you're addressing both the myofascial system, the muscle fascial system. And to get releases, to get this fascia to soften, to release from the knot it's been in, it's called a myofascial restriction. That's what happens through our lifetime when there's overuse, repetitive use, stress, injuries. The fascia in that area binds down like baling wire. It gets really tight and glued thick because it's dehydrating. And so when it does, it's doing that compressive maneuver through these pain-sensitive structures. So if it's through a muscle, that's pain-sensitive, or tissues of the tendon, those are all pain-sensitive. So the fascial restriction causes pain, but we also start losing mobility. Myofascial release, what we're doing right now, uses mechanical energy, and we're using mechanical energy of compression right now, placed in the system for a minimum of 5 minutes to elicit an electrical flow. And that electrical flow is what flows through the fascia, and when it comes to that glued down, dehydrated area, helps it to rehydrate, soften, and lengthen, and therefore release pain, get your mobility back. So that's the reason for minimum of 5 minutes. However, you can stay here for 10 minutes, you can stay here for 15 minutes to help that area get even more and more releases in it. It won't injure you, it won't hurt you. Staying here longer, all it does is help to get more release. So, but it's always a minimum of 5 minutes to get that electrical flow going. All right, so here we are, we're coming up to our last 15 seconds. You just want to check that you're softening, you're breathing easy. That means that you're really allowing that compression to get in there, do its job. When you're done, when we're going to be here another few seconds, you'll see I'm going to get up slowly. I'm going to move very slowly because most of us haven't been in this position for a while. So you just want to take care of your body. Always come out of new positions slowly and easily. And as I said, that position is for about 80% of the viewers here today. Can get in and out of that position. Make sure you do this for 14 days in a row, both sides. The place of the ball goes to the side of the belly button about 1 inch. Side of the belly button about 1 inch. And from there down, that is your psoas. From over here down, that's a psoas. So you kind of move around till you find that sweet spot, and then don't move for 5+ minutes. So for those of you who can get in and out of this position lying down to get to the psoas muscle, that's it, you're all done. For those of you who'd like to find a different position to help I've got 2 modifications coming up in a seated position for you. Here's the first modification for the Psoas release maneuver. And you're just going to be sitting at a counter. It could be a kitchen counter. It could be a bathroom sink or a table, the dining room table. As long as your belly button is even with the side of the table or the counter that you're at, that's all you need. So for me, you can see I have got a little cushion on top of the chair bottom so that it lifts me up a little, because now my belly button is across from it. Before I was too low. So you're in this position, and this time you do want to have a very firm object. So I've taken the bigger ball, which has got more rigidity to it. You can use a baseball, a softball. You can use a tennis ball, racquetball ball. Any of those will be fine. And you're going to find your belly button, and you're just going to go 1 inch to either side. You're going to want to work both sides, so start with either side. And you're going to lean forward. Use your arms and forearms to lean yourself forward. I'm leaning forward from my hip here, keeping my back straight. I'm not doing this. I'm up nice and tall. I'm bringing my weight forward, and I am pressing it in. And now I'm just going to kind of move around a little bit. I can feel I need something a little higher. And we're going to start the clock. So now the clock is on. And for those of you who are still looking around for a spot, so if you found a spot, the clock has started. For those of you who haven't found a spot, you can also just take your fingers, find your belly button, go to the side about 1 inch either side, and start pressing in. And as you press in, you'll find a good spot. And then you can just put the ball there too. Either way works. So you can move around like this, or you can move around with your fingers first. So find that and then come back and start the video right here at the timer. For those of you who are already with me, as you lean forward and as you feel that you're nice and relaxed, you're soft, you're leaning forward at your hips, your forearms are holding the weight of your upper body, you come forward. Stay where you feel the worst. I know that sounds terrible, but we want this to be effective. So you gotta stay where it's the worst. As long as you're breathing naturally, as long as you're not tensing because of the pain, you're fine. But you do want to make sure you're on a place that's uncomfortable. That means you're on a myofascial restriction. So I keep talking about this myofascial system. So myo means muscle, fascia is this big cobweb we have in our body. I'm going to move away out of this position for a minute because I want to demonstrate something to you, but the rest of you stay in your compression position. So in our bodies we have this cobweb, and it's called fascia. It runs from the top of the body, top of your head, down to your feet, side to side, and forward and back. And this sinewy cobweb surrounds, it supports, and it infuses every structure in our body. So our muscles, our blood vessels, ligaments, tendons, organs. Your organs, eyeballs, your brain, your spinal cord, your bones, everything has a sinewy cobweb around and within it. Well, when we're injured, an injury can be several things. It can be overuse, repetitive use. You could have a fall or a trauma, getting hit by a car, or something like that. And stress, just being alive on this planet. All of those things cause fascia to bind down, tighten, and it dehydrates and it gets really glued down. Well, when it does, it can place up to 2,000 pounds of force per square inch in whatever's in its way. Well, all of those structures, those muscles, tendons, ligaments, organs, etc., are pain sensitive. So one, a fascial restriction, which is that area of glued down, dehydrated fascia, will cause pain, but it also creates a loss of mobility, of natural mobility. So in order to regain or to get rid of those myofascial restrictions and regain the natural environment, we are using myofascial release. This is particularly the John Barnes myofascial release. That's how I was trained. And so it requires a minimum of 5 minutes of mechanical energy. In this case, we're using compression as mechanical energy. And when you put mechanical energy into the human body for a minimum of 5 minutes, it starts this flow. It's called the piezoelectric effect. It's a bioelectric effect, and wouldn't you know, it happens to run right along the fascia. It's kind of like fascia is the copper wire in our body. And as it's running along, when it comes to those places that are adhered and dehydrated and tight and bound down, that's myofascial restriction area, it causes them to rehydrate, soften, and elongate. So there's less pain, improved mobility. Now, tissue does have memory, so you can work on yourself one day and the tissue starts tightening back where it was. That's why you go back in and work a second day. And I often say in these videos that once you're done today, make sure for the next 13 days you work on yourself every single day so you can start getting permanency to the positive changes that myofascial work is doing for you. Now after that, after 14 days, then you continue for as long as you're active, 2 or 3 times a week. You still want to get it in there because you're counteracting what society is doing. Maybe you're flexed and bent over work a lot or over kids, and that psoas gets tightened back up. And the psoas, by the way, is an area we put all our stuff in. Our worry, doubt, fear, anger, grief, distrust, all of that is stored here. So when you're working on yourself, what you're feeling for is a release. A release feels like less pain, softening in the area. You might be on this and you feel it going somewhere else. You might feel finger-like projections. As those finger-like projections soften, that means you've got a release in your fascia. Sometimes just a sense of well-being. An emotion might come up. All of those are experiences of the fascia softening, and that's what you want. So minimum of 5 minutes, and that's where we are. We just hit our 5-minute mark, but you can continue. You can do 10 more minutes if you like. It won't bother you. It won't hurt you. You'll just get more and more release. All right, so this is the first modification. Stay tuned. I'm about to do the second modification for the psoas release. This is the second modification I was talking about. I'm going to use a Theracane, and if you look in the description below, there is a link that'll take you to where you can get a Theracane and have it delivered to you. So I'm going to use one of these structures off the shaft of the cane, and I'm going to find my belly button. I'm going to go about 1 inch to either side, and I'm going to use one of these knobs right on that spot. I'm now on the psoas, so I'm going to start kind of angling, and I'm feeling for an area that's tight or tender, and you're going to find you're going to go in. You're not going to hurt yourself. If it's not painful, you're not hurting yourself, but you are looking for a spot. Now when you get to several spots and you feel like I'm not really finding anything, go back and just stay on a spot and angle. And as you angle around, and what's happening, I'm putting the Theracane on a spot, and I'm doing this. I'm angling to different sides. I'm not going back and forth across it. That's massaging, that's rubbing. That's not what we're doing right now. But as you go and angle in, one of those angles is going to be more painful than the others, and that's where you want to start. So you can use the shaft of the cane, you can use the base of the cane. You might feel this is more comfortable for you and you get more out of it. Personally, I think I can get more power with less effort from my shoulders and hand this way. But everybody's different because everybody's body's different. So you find what works for you and what is the most comfortable for your shoulders. Let your elbows come in. You're not working like this. You want to drop your shoulders, drop your elbows, so you use your body very efficiently. Look at what I'm doing. I've got my back all the way back here. My rear end is to the back of the chair, so I'm nice and supported. I'm not out here and I'm not crunched over. These are all really important pieces of being successful to treat yourself for 5 minutes. All right, so let's start the clock. If you haven't found a spot yet, just pause the video right now, and then you can come back to it. So I'm in here, and I'm just going to angle around. And really for me, actually, this big of an angle is where I feel it. Interesting. So, oh, I feel it over here too. All right, I'm going to stay here because this is actually a very easy spot for me to be in. I don't have to use a lot of energy for this. All right, so once you're in your spot, soften your body, soften your breathing. You can close your eyes. And it's really good when you're treating yourself to close your eyes and see inside your body, see inside your mind's eye the area you're working with. And get a good visual of what it looks like. Maybe it just looks like a jungle forest that's just thick with vines and roots and leaves and you can't get through it. Whatever its presentation, See that presentation three-dimensionally, and then see it softening. Just see it softening, relaxing, becoming fluid, and see that restriction, that area of pain, moving out towards the surface of your skin. You're doing this with your eyes closed. And as it gets to the surface of the skin, envision the skin opening up. And then you get as much of that pain or that tightness or discomfort out. And when you've gotten it all out, or as much of it as you can get out through that opening, close the opening behind, and then come back to where you're working, see that area again, and see if you could spot any other areas of tenderness or tightness. Using the mind-body complex like that really facilitates healing. It's amazing how it works. There's more and more science and studies coming out to show how and why it works. We even know that it's the Olympics right now going on in the summer of 2024, and we know that the Olympic athletes, they envision what they're about to do. If we're going to see Simone Biles run down the runway to her do a vault, she's imagining herself already, seeing herself do it, because that's getting that neuromuscular system set up for success to make that, what she just envisioned, happened in real life. So use the power of that, of the mind-body system, mind-body complex. Remember, you're staying on one spot. You don't want to move off that spot. You can change angles on the spot, but do not move off your spot for the first 5 minutes. That's how long it takes to get that electrical flow I was talking about going. It's just a fancy word, piezoelectric. It's just referring to the bioelectric flow in our body. And this mechanical energy of compression, after 5 minutes in the body, elicits that electrical flow. That's the healer. That's what's helping. We're just helping maintain the mechanical energy to get that electrical flow working. And then we're staying there so we don't stop the electrical flow from working. If you have to get up to get a glass of water, or you don't like the position, you take your pressure off. Now stay on. I'm just going to demonstrate. If I take this away, and then I want to come back in because I'm going to get my glass of water and do something else and itch my back or whatever, the clock starts over. You can't pick up from where you were in your first 2.5 minutes. You have to start at 0 and go for another 5 minutes. So you're on that spot. If you're feeling sore, that's okay. You're on a good spot. It probably hasn't been treated your whole life. And if it's too sore, if you're starting to tighten, you can back out a little. You'll still be effective, but maintain that contact, because that's what's keeping the mechanical energy in there. And that mechanical energy is what's keeping the flow of the electricity going, the bioelectric flow going. And remember, you can be here for 10 minutes if you want. You can be here for 20 minutes. You won't injure yourself. All you'll get is passive range of, the worst thing is you get passive range of motion you didn't need, and that's it. The best thing is you're getting more and more fascial releases. Myofascial restrictions lay down just like layers of the onion. The original one, which could have been here from when I was 5 years old and my brother scared me jumping out of a closet, could have been there since I was 5, and then every time I have something happen that creates a restriction in the psoas, it puts that next layer on there. And so as you're releasing, you might feel, oh, that feels better. Oh no, it's coming back. It's not coming back. What's happened is you've gotten to the next layer of the onion, and so you're getting different releases. All right, so we've come to our 5 minutes. Very, very slowly take the Theracane out. Take a nice deep breath. Are you breathing deeper? When you stand up after this, see, are you standing taller? Tonight, do you sleep better? You never know when we work on the psoas what positive effects you get. But remember, please, please, every day for the next 14 days, continue giving yourself the treatment on both psoas so you really can maximize what it can do for you. And after that, 2 or 3 times a week for as long as you're active. All right, thanks again for showing up for yourselves today, and I will see you in the next video.